Now, and again, the cost is one aspect of adopting EHR. This is something that we would like to eliminate on all fronts. Financial costs are not the only costs, of course, and we understand that. We've eliminated the financial costs off the bat, including sign-up, bottom line, hardware. But of course, it's going to be about implementation. So what are the next steps? What does it mean to implement an EHR for your practice? Well, we have a Live in 5 promise. It's not up there now, I'm just going to kind of briefly outline for you. The Live in 5 promise means that within 5 minutes, you have access to the complete application. You go to practicefusion.com, you click on sign up. The account that you're given is not a demo account. It's not a trial account. It's not a half functional version. It is an actual account. If you decide to implement, you just move forward with that same login and we'll customize it for you. But the reason why we do this is because we feel very strongly that the application speaks for itself. And so if that's the case, we want to provide you with complete access. We don't want to just give you spiels and value props. We want to actually show you what it is. And because it's both web-based and free, there are no downloads and no fees. So signing up for this account involves no obligation. You just get complete access. So what I encourage people to do is to sign up, take a look at the application. There are 5 test patients in there, so you can really, as I just did a moment ago, do some charting. Because of course, John Doe is not an actual patient for you. It's a test patient in there. Now, another kind of step to get you started is that we will upload your demographic information in about 1 business day. That will get your patient list completed, so that way you log in, you don't have to input that yourself. It eliminates a lot of data input. This is a no-cost service that we like to provide. It's something that we do on a daily basis, and it's very easy. Pretty much all we need to do is set up a 5-minute phone call with a support specialist to find that information in your billing or schedule, whatever it is. Make sure it's in the format that will be read by our system. We'll transfer that over in about 1 business day. Now, you did ask about transferring medical information from one system to another. Now, to be honest with you, there are standards being put in place right now because this is a burgeoning new field. So, the industry is in a transitional phase. They're trying to come up with standards. Oftentimes people ask me for instance, how is a patient going to sign something electronically? Well, the government is going to be giving people PIN numbers, things like that. So there are standards put in place. Right now, during this transition period, EHR technology has not been storing the information exactly in standard ways. So it's never a direct transfer of your chart information from MedSoft to Practice Fusion. Demographic information, very easily transferred. We will work with you, an actual person goes. Yes.
Now, when you say demographic information, what does that entail?
That would be first name, last name, address, zip code, phone number, contact information. So who the patient is.
The totality of that. Okay.
Exactly. Now, of course, we understand maybe for the last few years you've been collecting medical information in the system. You can't walk away from that information. We'll work with you with various ways to get that into Practice Fusion.
Okay.
Now, if that means that it can't be a direct transfer all into the template system, we'll talk about documents, uploads, screenshots, something like that, because, again, moving forward, we don't want you to lose any information. That's not the reason of having an EHR. It should only be helping you. So, there are some standards being put in place, but our support specialists are well versed in getting workarounds to obtain that information. Uploading the demographics is a great first step. That's something I always encourage people to do right after that, because again, the EHR will be more yours, will be more implemented when you see your list of patients in there. And the real question is, what does it mean to implement an EHR? It means to be able to talk to your patients and use your patient information in the EHR. So that's how we first get you started up. Yes?
So Sean, in using Practice Fusion in his practice, uploaded a CSV file with the patient demographic information, and then as the patients came in, he filled in the rest of the chart, as opposed to trying to upload every chart
Exactly.
or pay someone to digitize all his files.
You wait until they
So-
come in. So, he didn't have a practice management before that, a database that he could have uploaded, it was all, that's my question. So if you have Metasoft, or you have
MySys or
Practice
something.
and you
I'm not
have like
sure
years
if he was
of-
on another system. He may have been on another system and he just pulled the CSV file from his other system.
But if you chose to migrate that information into this file, because you have 5 years of really critical health information with patients who stay patients for a long time.
Mhm.
You know,
Right.
you have labs, and maybe you work in cancer, hepatitis, or HIV, or geriatrics, and so you really want the full file.
Mhm.
So you would have the possibility to just do, so I asked you about demographics, is that doesn't include personal health information?
That's right.
That's the
Exactly.
difference I
And
was trying to.
the reason
unpack.
why is because, these other systems have been around for 10 years. They haven't been storing the information necessarily in a structured way because there haven't been standards. Now, moving forward, all of this will be standardized as
Okay.
the industry gets a feel for how EHR technology works. So, what kind of stops that information from being directly transferred, again, is the fact that we can never know how that information was directly stored in that system. But there are very many workarounds by
Okay.
uploading that information. And if you have paper documents, to be honest, while we do provide partner services that will securely scan and digitize those records, a lot of people just kind of keep their paper records in file, move forward with Practice Fusion. So there are different workarounds depending on how much information you have stored, how it's stored, what your workflow is going to look like. And the advantage of the fact that our support team are in-house, it's Practice Fusion employees. They've worked with various different practices and using different technologies. When you call them up and say, hey, this is the system I'm using, I'd like to transfer information, they'll have a good idea of what kind of workaround will be best for you because they've probably done it before with someone else. So yes, this is something that just requires a quick conversation, but I really do emphasize support at Practice Fusion because again, until there are specific standards in place, you're going to need to have somebody who has the knowledge to do it to help you out. And we do provide that at no cost, so definitely something to take advantage of. Now, you did mention labs, and Pam, you mentioned lab work. We do integrate with labs to get the lab results into Practice Fusion itself. What happens is they arrive, for instance, as a PDF file, automatically attaches itself to the proper patient. Advantage of that, again, as you all know, you can access that from home. You can access that from a different location. It's just stuck in Practice Fusion. It's not in any particular location. Those lab results will also be a significant advantage of EHR moving forward because also you can order labs from Practice Fusion. Now this of course has been something that people have liked because they don't want to go through the process every time of sending the request in. Instead, you can order the lab from the patient's chart, just a couple clicks of a button. Information flows directly to the lab results flows directly to you. So lab integration is also a big part of how to use an EHR. It's something that we are always pursuing, spreading out to more labs. E-prescribing is also an option out there. You don't have to necessarily e-prescribe though. You can just come up with a prescription that you write yourself, print it out from Practice Fusion. It's saved in your patient history. So no matter how much you want, whatever you want to give, or just print the plan section. You can create a plan for the patient. You could tell them how you want them to be sleeping for the next 7 nights. Print that out to them. They've got something right there with your contact information, an official document on where they should be going moving forward. Because this is customizable, I like this because it tends to be when I go to a doctor or a provider and I get a plan, it's kind of just this standard spiel that the whole company is using that's often too much information.
Discharge order.
Exactly, and I tend not to read too much of it, unfortunately. But you know what? If you are coming up with a plan, printing it directly there, I think that's going to be much more accessible to the patient. And again, as I mentioned, the chart sharing feature, you can share chart information with other providers securely, whether or not they're using Practice Fusion. This is something that the government wants to happen with EHR technology, is sharing information securely.
You mean you can let the doctor who refer the patient to you to say, go for this Practice Fusion and get information?
Yeah, they
like
can.
progress report or something.
Absolutely,
like
but they don't even have to use Practice Fusion.
that? They don't-
So let's say you're using Practice Fusion and you want to refer a patient to a colleague of yours, but that colleague is on paper completely, not using the EHR at all. You can share that information electronically with him or her, even though they're not using it.
You can send an e-fax.
It's a bit more complicated than e-fax. Now, this is a secure, HIPAA compliant sharing feature. So it is kind of a vigorous module. It's something that we've been putting in development for a while because it is something that does require some technology behind it. But again, this is a secure sharing feature, whether or not they're using Practice Fusion. It's something that we're very excited about because it's really getting into how an EHR can especially work for the medical community as a whole. And again, there are ways to communicate. For instance, we will also be implementing soon a forum to people to talk, to share information on. But the chart sharing specifically is a secure way to share medical information, which is a bit different from just communicating specifically.
It's a email link, is it not, that they have to, it's like a double sign-in process?
Are you talking about the PHR perhaps?
No. On the sharing the chart, if I recall from the Health 2.0 demo, when you email the other practitioner who's going to be looking at the chart, they have to actually sign in and.
That's right.
Sign.
It creates a secure portal for them. Because the email itself, you can't share the information over the email itself. So the email is just used as a reach out to then provide them with a portal to get that information back and forth. Yeah. And this again is the way that EHRs need to be working for the medical community to be able to share information.